The night before your embryo transfer and you're feeling both excited and anxious. There are so many things that needs to be done. Don't oversleep, don't forget the documentation or medication, for example. These are all normal, but what about the rare fears that spring up in your thoughts? This video will be very helpful, so stay with me. Hello everyone, my name is Anna and I'm an IVF patient advocate and medical researcher whose mission is to support individuals and couples on their fertility journey. Today you're going to learn how to prepare a smooth and stress-free IVF experience abroad. Do you have concerns about medical mistakes like using the wrong person's embryos? Well, not just with IVF, but with any medical procedure. You don't want to end up in the wrong room or table. While these situations are rare, they do happen, and that causes worry. Patients can take a number of steps to minimize the risk of identity confusion. This checklist is not just for IVF patients, but wherever you are in any medical facility at home and especially abroad. Avoid these situations you sometimes read about in the newspapers, wondering how it could happen. Well, it's simple. It's a series of unfortunate events, as I'm calling it, and most importantly, you need to realize the mistake before it's too late. Sometimes the mistake is caught at the beginning of the process and we can joke about it. But rarely does it turn into irreparable physical or psychological damage. So if you, as a patient, can do as much as you can to avoid getting confused, that's your job. And here's how you can minimize it to happening to you. When you arrive at the clinic, make sure the nurse will confirm your identity by checking your ID card or passport. You will be asked to sign informed consents prior to the treatment. Check the details such as name, address, birth number, and all treatment details. When you are called by an IVF nurse, make sure you hear your name well, especially abroad when the clinic staff can mispronounce your name due to language barrier. If you're not sure, let the nurse again check your ID card or passport to confirm the identification. In the operation theater, prior to the embryo transfer, the clinic should ask your name, so you say out loud your name and surname. It should be you who states your full name. If the clinic asks, "Are you Mrs. Brown?" your yes is not sufficient. There's a lot of stress and adrenaline going on, and it's so easy to confuse Brown and Braun in such situations, so you can be confirming the wrong name and you will not even notice it. When the embryologist arrives with your embryo, again he or she needs to say out loud the name that is on the label or show it to you on the screen so they confirm again that the right embryo is placed into the right patient. If you're nervous and overwhelmed, ask your partner to help to double check and keep an eye on everything. If he has any doubt, he can always let the personnel know. If anything seems odd or wrong, let the clinic know immediately. Do not wait until the examination or, in the worst case, after the embryo transfer is done. Even if you have to scream, do it. Shout, just let the clinic know to stop the procedure and double check again. Thank you all for joining me today. I understand this can be a challenging journey, but I hope this video has given you some guidance and reassurance along the way. For more information, I welcome you to visit my website aboutivf.com, where you will find all the necessary materials and contact details if you have any questions or you need individual support. Whether you're a passive user of my website or actively seek to work with me, you can be sure that you, as a result, will gain confidence and improve your IVF experience. Take care, try and stay positive, and remember that you're not alone. Together we'll travel this journey with hope and determination. If you like this video, please share, like, comment and subscribe. Thank you again, and I'm going to see you with the next episode.